Hello, welcome to another video. So our topic for today is the vaccination of children aged 12 to 17 against COVID-19. So alam natin na nag-start na yung rollout sa Metro Manila ng COVID-19 vaccination. Yan. So this will help our children and protect our children against COVID-19. So alam natin yung last ng video natin, diba? Na-discuss natin yung booster at sino yung mga priority groups doon. Ngayon, we will discuss some of the questions asked regarding this COVID-19 vaccination in children. So yung source natin are the materials from the pages ng Department of Health para sigurado tayo sa mga i-share natin information dito. Ayan. So hopefully, through this video, you will be encouraged and be motivated to vaccinate or immunize your children against COVID-19 habang libre pa siya ngayon, no? Malay natin in the future, mamaya may bayad na yan. So ngayon pa lang, i-grab natin yung opportunity at sayang yung opportunity at may mga supplies tayo ngayon sa vaccine na ito. So that we can contribute na sa herd immunity sa ating bansa. So let us start our topic for today, no? It's all about the vaccination of children against COVID. So ito ay nasa range lang ng age 12 to 17 years old. Yan. So let us start with the first question. So ito yung under the category of A3 na sinasabi ng Department of Health. At sila yung priority ngayon for the vaccination. So, sabi dito, yes, children aged 12 to 17 years with risk factors, 12 to 17 years old with risk factors or comorbidities. So, example, we'll discuss it later, no, after this section of the video. Are now part of the A3 priority groups as what I have said a while ago. And will be called pediatric A3. Yan. Okay. So now let's proceed to the next question. So alam natin, di ba? Na-discuss ko rin yung different brands ng COVID-19 vaccines. Yung lalo yung mga popular brands. So ano nga ba? So to date, only Moderna and Pfizer vaccines can be given to the pediatric population ages 12 to 17 years old with comorbidities. So these two COVID-19 vaccines have the emergency use authorization from the Philippine Food, Drug and Administration. So dalawa po, ulitin natin, yung Moderna and Pfizer lang yung ngayong nabigyan ng emergency use of authorization. So from the list of the vaccines na nandito sa ating bansa. Okay? So paano ba i-rehistro? Kasi siyempre tayo bilang magulang gusto natin mabakunahan din yung ating mga anak. Lalo na kung may mga comorbidities or risk factors. So una, first, contact your child's pediatrician or hospital to get a schedule of the vaccination. So contact the pediatrician. Click the link for the list of 8 hospitals included in phase 1 rollout. Ito yung phase 1 rollout, yung sa Metro Manila to. Nag-roll out na sila, no? So we will provide dito, banda dito, no? Yung infographics regarding the link kasi nag-roll out na nga siya sa Metro Manila since last week. So may 8 hospitals yan sa NCR. And then, so pag na-click nyo na yung list ng 8 hospitals, so andyan na siya, no? You must bring the following documents for your appointment. So first, syempre may kailangan medical certificate given by your attending physician or pediatrician detailing the comorbidity or comorbidities of the vaccine recipient. So may medical certificate dapat na magpapatunay na mayroong comorbidity siya. So andun yung details na yan. So after this, yung next na section nitong video, we will discuss ano yung mga comorbidities na nalista ng Department of Health to be qualified for the vaccination. And then second, documents to prove affiliation. So, meaning dapat kung ikaw yung guardian, it's either ikaw nanay, tatay, or kung sa ibang institution, yung sa ampunan, no, may ganon, syempre yung head ng ampunan yan. And then yung legal guardian din. So to prove the affiliation, any document that will prove the affiliation, so birth certificate, kung ano-ano pa na para mapatunayan yan. And then C, or the next step is kailangang dalhin ang document, valid identification cards or documents with photos of parents or guardian. So may picture dapat. Siyempre baka na-block mo lang yung bata o nakikipabakuna ka lang, no? Hindi yun pwede. And the vaccine recipient to verify documents presented. So example, nag-present ka ng passport. So kailangan may picture kayo together with the parent or the guardian kasi baka nga pinasuyo lang, bawal po yan, no? Hindi pwede yung, uy, papila mo nga. Then, sige, baka ito na yung requirements kasi baka nauna ka, ganyan. Hindi pwede yan. So, dapat may picture and then proof of affiliation. Okay. Another one. So, the parent or guardian must accompany the vaccine recipient at the vaccination site. Hindi po sila pwedeng mapuntahin doon mag-isa o solo lang nila pumunta doon. May kasama silang guardian or parent. Yan. So, yun yung mga requirements or steps on how you will register your child para mabakunahan sila sa COVID-19. And then, another one, no? Kasi, ages 12 to 17 lang. Siyempre, meron yung below 12 and then below, above 17. So, kasi petya pa yung tawag ng pag 18 and then 21 years old. So, how can you protect them? So, siyempre, you must continue the minimum public health standards. So, ito yung mga yon. Yung sasabi natin, mag-mask, siyempre, maghugas ng kamay, umiwas sa mga mataong lugar, at dapat, lalo na yung, umiwas din sa yung mga enclosed areas. Ayan, tulad ng mga malls, mga restaurants, etc. So, dapat meron daloy ng hangin yung mga pinupuntahan natin. At syempre, depende sa LGUs, yung kanilang current policies and rules and regulation, kung anong level yung kanilang quarantine status ngayon. Kasi, di ba, may bago ng level yung national government. So, depende doon kung paano or kailan pinapalabas yung mga bata, no? So, depende rin yan. Kahit na open air, kung hindi naman siya allowed, so syempre, no siya. Okay, so syempre, protect yourself and be a shield for your children. So, ikaw, protectionan mo, lalo-lalo na yung iyong anak, yan, against COVID-19. So, those are the major questions that were asked regarding this another good news, sa ating bansa, na pwede nang mabakunahan yung ating pediatric age 12 to 17 with co-morbidities or risk factors. Yan. So, ngayon, yung next natin na question, ano ba yung mga list of comorbidities or risk factors na pwedeng mag-qualify yung aking anak na age 12 to 17? And then, yun nga, dapat may patunay yun na sa medical certificate. So, una, ito mahaba-haba siya, no? Lagyan natin dito pa rin yung infographics or yung lista from the site na napagkuhanan ko. Siyempre, yung source niya is yung DOH materials para sure tayo. So, ano itong mga to? Mahaba-haba po ito, no? Pero i-discuss ko lang yung mga major features niya, major categories. Hindi ko na i-discuss yung specific categories, kasi mahaba-haba pa siya. Pwede naman siya makita dito. And kung may question kayo, pwede naman yung bisitahin yung link ng Department of Health. Sa Facebook, meron silang page. Pwede nyo yung hanapin. Or you can seek the assistance of your rural health units or city health units or your local government units sa inyong mga areas. Okay, simulan na natin. First, yung medical complexity. So, sorry, may binabasa ako dito para sure yung ating mga sasabihin dito. Ibig sabihin nun, long-term dependence on technical support. So, ito yung mga may tracheostomy, yung may butas dito, associated with developmental delay or genetic anomalies. So, yung mga medical complexity, yan yung una. Ikalawa, genetic conditions such as yung Down syndrome and other genetic condition. Papakita ko na lang dito later on yung specifics niya under that category. Yung pinaka pinaka common is Down syndrome and other genetic abnormalities na makikita nyo dito later on. Ano pa ba? So, neurologic conditions. So, example dito yung seizure disorder. Ayan. And then, cerebral palsy. Ayan. Yung may CP. Tinatawag nga nila. Cerebral palsy. And then, stroke in the young. Ayan. Yung mga yan. Chronic meningitis. And chronic neuromuscular diseases. And chronic demyelinating disease. So, lista rin dito, kasi depende yan sa diagnosis din yung pediatrician dun sa medical certificate na ilalagay. So, dapat kasama sa lista na yon na papakita dito later on. Ano pa ba? Yung mga risk factors or comorbidities. O, next yung tuberculosis. Ayan. So, it's either pulmonary, yung sa baga, and then extrapulmonary, and then disseminated, no? So, or to other organs. Kasi may mga TB rin na, or tuberculosis infection na pwedeng makita sa ibang organs o sa ibang parte ng ating katawan. Ayan. So, makikita rin yan later on. Ano pa ba? Hepatobiliary disease or chronic liver disease. So, may mga ganyan. Yung nasira na yung atay. Ayan, etc. etc. So, may tatlong under that category. Ano pa ba? Yung cerebrovascular disease. So, example nun, hypertension. Kasi sa age 12 to 17, pwedeng may high blood na rin sila. Congenital heart disease, yung may sakit sa puso ng bata pa. And then, other heart diseases na mapapakita ko dito. So, yan, no? Pang ilan na yun? 1, 2, 3, 4, 5, pang-6 na yun. Ano pa? So, marami sa lista na to, no? Na pinapakita. Next is chronic respiratory diseases. So, marami po yan, no? Makikita nyo mamaya sa lista. Renal disorders such as chronic kidney disease, nephrotic syndrome, and others na mapapakita din dito. So, mga renal disorders. And then, ano pa ba? Immunocompromised state due to disease or treatment. So, may mga ganyan, no? Yung mga bone marrow or stem cell transplant. Yan. Example nun, or solid organ transplant. Ayan, mga yan. So, qualified sila. And then, marami pa. Makikita nyo mamaya. I-share natin dito. Hahabaan natin yung pag-share nung lista na yan para mas makikita ninyo. And then, another is metabolic or endocrine disease such as diabetes. Kasi may mga ganyan, na mga bata may diabetes na. Hypothyroidism. And then, other metabolic or endocrine diseases that are listed on the list of the table na kita natin dito. And lastly, yung obesity. So, yung mga malalaking bata, yung BMI or your body mass index na more than the 95th percentile for age and height. So, yan, no? Marami. So, meron tayong, ilan ba ito? 8. Merong 1, 2, 3, 4, 5, 6, 7, 2, 4, 6, 8, 10, 11 categories ng list of comorbidities and risk factors. So, kung nakita nyo na yung mga anak ay nabibilang sa lista na to, you must consult your pediatrician, and the pediatrician or the doctor must give you a medical certificate that will prove that they have these conditions, and that is part of the requirement. Okay. So, based din sa news, ang balita, after na ma-roll out siya sa NCR, it will be rolled out starting November 3. So, itong linggo na to, susunod na linggo na to, after ng undas, maro-roll out na siya. Siyempre, depende pa rin yan sa availability of the supply. So, natural, every provinces, municipalities, or cities will have allotment. And syempre, sana tuloy-tuloy yan, And hindi naman yan one-time rollout din. And kasi syempre depende nga sa supply. So hopefully, based on the timeline of the Department of Health, hanggang next year ata yan na i-roll out nila para maubos itong mga pediatric or children with comorbidities ages 12 to 17 years old at mabakunahan silang lahat para ma-achieve natin yung herd immunity. Kasi lumalabas na ilang percentage din, no, based on the studies, ay mga batang nasa age group din nito, meron pa mas mababa pa, no, ang nakakaroon ng sakit ng COVID-19. Okay. So marami tayong napag-usapan sa video na to. So makipag-ugnayan na po sa inyong local government units, kaugnay sa pagpaparehistro at iba pang mga impormasyon or detalye regarding the vaccination of children ages 12 to 17 years old para po mabakunahan na po sila. And again, it will be our contribution to the herd immunity. Okay po? So sana po ay nabigyan kayo ng magandang or our knowledge regarding this good news again from our government and from Department of Health, kasi dumadami na rin yung supplies na dumarating na mga bakuna sa atin. At sana nga matapos na itong COVID-19 and this is part of the new normal that we will be facing. Okay, so thank you very much again. Please subscribe, like, and share this video, and thumbs up po, i-like niyo yung video pag nagustuhan niyo po ito. And please comment down below kung ano pa yung gusto nyong mga i-upload natin sa aking channel so that we can schedule yung mga content na gusto niyo. Again, please subscribe, share, and like this video. Thank you very much. Ingat po tayong lahat. Bye-bye!